Good morning, ladies and gentlemen. It is Tim Torok coming at you again, and today is Saturday, March 11th, 2017. And in the headlines, of course, is healthcare. The Republicans have come out with what they call the American Health Care Act, and it's a pretty good start, but it doesn't go all the way. And this morning, I've taken the opportunity to put together 9 points that I feel are a fabulous solution for the United States and any healthcare system worldwide. Now, I want to advise you that I have worked in medical billing for my parents' dermatology practice for almost 9 years now. Okay, so I do have some experience with medical billing in the healthcare insurance industry, and I also have experience with capitalism and freedom. So let's get into it now. Number one, I'm trying to make this as simple as possible, okay, and we can read right along. No more employer-based insurance. There is no reason why you should have to get your insurance through your employer. It is just not the right way to go, because if we allow people to get their own insurance by any means they choose, they can take those policies with them to wherever they go, wherever they are, wherever they're sick, whenever they pass away. The policy of employer-based insurance began during World War II, and like I said, probably due to unnecessary regulation. So there you go. That's a little background on employer-based insurance. All right. This allows consumers/patients to choose the right insurers for them instead of so when you get a job, folks, usually there's only one insurer that you can choose from. But if you can choose your own insurance outside of your employer, you can choose from Anthem, United Healthcare, Aetna, Humana. Any of those can compete for your business, and that is beneficial to consumers, ladies and gentlemen. All right, so let's get on and of course, this leads to less headaches and confusion when leaving jobs. I can tell you, in my industry, people get confused when they leave their employers as to when officially their last coverage dates were. So allowing them to decouple or take that away from their employers gives them greater understanding and freedom when it comes to their insurance coverage. All right, number two, ladies and gentlemen, very simple, no tax deductions whatsoever for anyone. This makes it, everyone is treated equally, and it makes it very simple for the government to manage and regulate. No excess paperwork or unnecessary paperwork involved. Number three, no mandatory insurance policies. People should not be forced to have insurance. It is not something that is mandated by the United States Constitution, and I might add that the United States Constitution is a pretty well to very well written document when it comes to libertarian principles. So getting on to no mandatory insurance policies, it says here affords consumer choice and less government regulation and red tape. So, for instance, if you are a very successful person and you have the money to back it up, you should not be forced to have insurance. You should be able to pay in cash if you so choose. Now, number four, Medicare has today what's called the MACRA program, and it is a continuation of PQRS and e-prescribing and so many different programs that Medicare has bundled together into MACRA. And it is very time-consuming and laborious. There is so much red tape and time involved in MACRA that it's probably not worth the money. So getting rid of this red tape allows physicians to focus on what they do best, and that is treating patients and not racking up unnecessary expenses in their businesses. Okay, so that's number four. Number five, slowly start to repeal and eliminate Medicare and allow patients to choose their own health insurance. Now, this gets back to choice, allowing competition to drive down prices just like it would in any sector. So, obviously, you have many people on Medicare and Medicaid. Uh, Gradually over time, you could start to reduce this. And I want to get to the next point, which is somewhat integral in reducing Medicare, and that is, well, first of all, realize that we cannot solve every single problem out there, whether it be health related or otherwise. Okay, so you got to factor that in. But number 6, strengthen families, ladies and gentlemen. When you have a strong core family unit in every area, that will allow for greater care for the elderly. People will have more money. They'll work together to solve problems as a family and take care of the elderly, just like the Amish try to do. Okay, and I point out here that families are the strongest bond to success. That's what I'm trying to iterate. That you have a strong family, you're going to be well off in many regards. And lastly, on number 6, the government can help to promote the family by promoting a strong family message through the ad council and things of that nature. So please, strong families. Now, number 7, what do you do about patients who cannot pay their bills in any regard? And as I say, that is the deceased and the infirm. So hospitals should be able to bill local municipalities when it is impossible to recuperate their charges from patients. However, for all others, medical providers and the courts should be able to work together to solve those problems by garnishing wages and getting people to work in order to pay their their bills in a timely manner. So that is number 7: how hospitals and the clinics, that can work together with the government. Now, getting on to the next page. Okay. It is important for providers and insurance companies to provide as much transparency as possible when it comes to cost and pricing. So, when a patient calls a physician to ask for pricing, or even in the office when the patient asks, because I know it's time consuming, the physicians should provide all applicable CPT codes, and CPT stands for current procedural terminology. Okay, so that encompasses all insurance-related office visits and all procedures in the business, CPT codes. So they should be able to provide all codes and the charge amounts involved. And when patients contact their insurance companies, the insurers should be easily able to recite for them the allowed amount of each charge based on the CPT code. So that way it's very transparent, and it's almost like buying a bag of potato chips at the local grocery store. Okay, so transparency is important. And number 9, and lastly, insurers should be able to provide physicals and use physicals to determine a patient's eligibility and coverage specifics and benefits. So that way, the insurance actuaries can make better actuarial tables and to determine what it's going to cost for an insurance company to provide coverage for a patient. So 9 points, okay. And like I said, we have no more employer-based coverage. Allow patients to get insurance through any means they deem, which would be the private sector and the individual market. No tax deductions. That way everybody is treated equally and it's very simple to manage. No mandatory insurance policies. This is not something that should be mandated by the federal government or any government. Repealing expensive and burdensome regulations like MACRA. Very slowly start to repeal Medicare and allow patients to have their own private sector policies. Again, strengthen families, very important. Hospitals should be able to work with the local governments to recuperate costs that are impossible to recuperate through patients. Transparency, as I mentioned, in pricing and physicals. So these 9 points, ladies and gentlemen, I believe truly to be the answer. I came up with them this morning after almost 9 years in the medical field, as well as, of course, some extensive government knowledge and libertarian knowledge as well. So 9 points. I truly hope that the Republicans, not only now but in subsequent years, as they hold on to the presidency and hopefully the Congress as well, can continue to advance freedom-oriented principles in the healthcare sector. So that's my take on it. I thank you very much for watching and listening today. Again, it is Saturday, March 11th, 2017. I hope you guys have a great day. Please subscribe to the channel and leave any comments that you like, and have a great day. Thanks a lot.